Good evening, everyone, and welcome to Postgraduate Opportunities in Association Management, the first of 3 web meetings in NCPA's Future Pharmacist webinar series. My name is Bree Morris. I'm a pharmacist on staff with the National Community Pharmacist Association, and I'm the NCPA Executive Residency Program Director, and I'm going to be your host for today's call. Before we get started, I want to let you know that all of today's meeting is being recorded. The slides and a recording will be available within 5 business days at ncpanet.org/residency. I do want to remind you about 2 additional webinars that are coming up that we'd love to have you on. We have new programs designed for student pharmacists looking to learn more about community pharmacy residencies. You'll get an insider's view on residency life and unique projects. On the first call, we have residents from Kelly Ross Pharmacy, Samford, UNC's Community Pharmacy Residency Program on Tuesday, November the 15th, and UK, South Carolina, and UNC's Independent Pharmacy Ownership Residency Program will be on Thursday, November 17th. We really hope to have you there as well. Tonight we've brought together 5 executive residents and fellows from the National Association in our country's capital to share their experiences so far. Without further ado, I'm happy to welcome our colleagues and panelists for today's webinar. Dr. Alexander Tu is the Executive Resident for NCPA and is a graduate of Belmont University. Next, we have Dr. Drew Register. He's the Executive Resident at the APHA Foundation and a graduate of the University of Louisiana at Monroe. We also have with us Drs. Lauren Kirk and Monet Stanford, who are both Executive Fellows at the National Association of Chain Drug Stores Foundation. Dr. Kurt is a graduate of East Tennessee State University, College of Pharmacy, and Dr. Stanford graduated from the University of Maryland College of Pharmacy. Lastly, we also have Dr. Mel Nelson, who's the Executive Fellow at the Pharmacy Quality Alliance and is a University of Arizona graduate. And with that, I will turn things over to our residents and fellows, and I believe that Dr. Tu is going to get us started. If you guys have questions throughout the program, feel free to just ask them through the chat box. We're going to have a quick presentation followed by a moderated discussion, and then we'll open it up for your questions at the end. So Dr. Tu?
Thank you, Dr. Morris. Hi, everyone. My name is Alexander Tu, and I serve as the Executive Resident at the National Community Pharmacists Association, or NCPA. And for those of you that don't know about NCPA, NCPA represents more than 22,000 independent community pharmacies across the nation. And so we are the voice of the community pharmacist, and we are dedicated to providing the tools and resources to help the local mom and pop pharmacies thrive in today's dynamic pharmacy environment. As the executive resident, I've had a number of different opportunities so far, and some of the main areas where you'll get to participate in as the executive resident at NCPA include advocacy, where you'll work with our government affairs team on legislative, regulatory, and rulemaking processes. You'll also have an opportunity to work in our NCPA Innovation Center, which is a new organization within NCPA designed to help pharmacists find solutions for their pharmacies. Some of the type of things that you could be working on include pharmacogenomics, transitions of care, collaborative practice, and many more. And finally, what I consider the most important part of the association space is member engagement, because without members, we don't have much of an association. So as the executive resident, you'll have numerous opportunities to network with community pharmacists as well as other members within NCPA's network. In addition, you'll be very active with our student chapter operations and be making school visits as well as precepting students while you're here. And then as the executive resident, it's our duty to promote the membership among community pharmacists and show why community pharmacists should become members. If you're interested in our residency program, you'll hear the similarly, across the other programs that will be discussed tonight, there is an application process, and that process begins with a letter of intent, recommendations, a transcript, your CV, and headshot. And from there, once we review all applications, we will invite qualified candidates for a phone interview and our top candidates for an on-site interview. Our application is due December 31st at midnight Eastern Time. And for more information, feel free to send me an email or go to our website, ncpanet.org/residency. Next, I'll turn things over to Dr. Register to talk more about the APHA Foundation Executive Residency Program.
Hey, good evening, everyone. As Alexander said, my name is Drew Register, and I'm the Executive Resident for the APHA Foundation. I'll just give a brief little disclaimer before I get started. If any of you guys are interested in any of our specific programs, please feel free to follow up with us after the webinar and ask specific questions. One thing that I'll say about each of these residency programs is that it's really hard to explain what we do on a day-to-day basis, and I think each residency kind of differs even for the residents within the same associations from a year to year, really kind of depending on the climate of pharmacy and what's going on. You may have different experiences than the resident coming the year before you. So if you have any specific questions and would like to follow up, please feel free to do so. I'll get started by telling you guys a little bit about APHA and kind of some of the things that are involved in our residency. For those of you who are unfamiliar with APHA, we're a little bit different than some of these other organizations in the sense that we represent and encompass all avenues of pharmacy. So we're not a specialty organization, and we really try to improve the profession as a whole and supplement practitioners in all different pharmacy pathways. A lot of what we do is in the practice department, we're creating and providing educational resources and tools and trying to advance pharmacy practice and also engage our membership and make sure that they have the tools they need to succeed in practice. One of the cool things about the residency is we're able to kind of be involved in the strategic direction and determining where the association is headed and where the profession's headed. So we get to sit in on Board of Trustees meetings and kind of determine where the organization is going to head in the future. Some of the things that I would say that you guys would develop through the residency, certainly leadership and advocacy. So there's a number of different opportunities for you guys to get involved in different leadership opportunities and association management. We also work a lot with the members, whether that's through collecting feedback through different webinars or working with different work groups. And then obviously pharmacy practice advancement. I talked a little bit about this on the last slide. Specifically, the APHA residency is housed in the APHA Foundation. So our specific responsibilities are the Pinnacle Awards, incentive grants, student scholarships, and the executive residency. And so those are all programs that the executive resident of the foundation oversees. So we're collecting all the applications for all of these different awards, scholarships, and grant programs and making sure that all those programs are running smoothly. And then outside of those programs, we are collaborating with the different departments of APHA on a number of different projects. If you guys are interested, you can obviously email me if you have any questions about the application program, but you can visit the APHA Foundation website. If you just Google APHA Foundation Executive Residency, our page should come up. We have a link on the actual page that tells you how to apply. We use a platform called Open Water. If you have any questions about that, just let me know. We do ask for a cover letter, basically addressing why you want to be involved in association management and why you're interested in the residency. We collect the CV and then just letters of recommendation. Normally what happens is we have a number of applicants that go through kind of a general application review, and then we would move to a phone interview. And then if you're selected, we would do an on-site for our third round of interviews. Our deadline this year is December 31st, and my contact information is at the bottom. Yeah, and next we are going to move to NACDS, and I'll let Monet Stanford start us out.
Hi, so my name is Monet Stanford. I'm one of 2 executive fellows at the National Association of Chain Drugstores. We also have Dr. Lauren Kirk here on the phone if he wants to go ahead and introduce himself.
Good evening, everyone. My name is Lauren Kirk, as has been said by multiple people. graduated from East Tennessee State University, and am privileged to work with Monet at the National Association of Chain Drug Stores for the foundation as one of the 2 executive fellows.
So we're just going to tag team our part of the presentation, and I'll just get started with describing what the National Association of Chain Drug Stores is. So just a little bit different from the other associations. We're what's called a trade organization, whereas the other ones were professional associations. So that being said, for example, with Drew at APHA or Alex at NCPA, their members are people, they're pharmacists or other healthcare professionals, whereas with NACDS, our members are often chain drug stores. So we have Walgreens, we have CVS. Any pharmacy chain that has 4 or more pharmacies can become a member of NACDS. In addition to that, we also have any other organization that is affiliated with a chain drug store. So that's from the front end to the back end. So we have pharmacy suppliers, trade press that write articles about chain drug industry. We have McKesson, wholesalers, but we also have things that can be sold at the front end as members. So that's L'Oreal or Coca-Cola. That just gives you a little bit of background about NACDS. And together as an organization, we have a couple of different departments, but together we foster an advantageous business environment for all of our members, whether that's legislatively, on the business front, advocacy, anything that you can name, we do. Then in contrast, we also have an affiliated but distinct entity called the NACDL Foundation. So that's a nonprofit entity, and that's actually where Lauren and I are housed as the executive fellows. So on the foundation side, we have 3 aims. It's philanthropy, research, and education. And so a lot of the output that we deliver comes from that side. So as an example, we like to promote anything that advances patient care or population health. So we have a couple of innovative projects, probably working with some of the schools that you guys go to as we speak, but we work in transitions of care, pharmacogenetics, point-of-care testing, anything that can advance the practice of pharmacy and set up sustainable models of care. That's something that we create on the foundation side. So I'm going to turn it over to Lauren now, and he's going to discuss some of the competencies that we're developing as executive fellows right now.
Thank you, Monet. And so those competencies that we feel are easily developed within our day-to-day basis and throughout the course of the fellowship are listed there on the screen. Right off the bat, the project management. As fellows, we are handed a number of projects that we're expected to work with other staff members to take from the beginning or from the point at which it's handed to us and see it through to fruition. So we're dealing with project management, whether that be independent as fellows or working with a team. We're also making sure and working with our members to understand how policy will ultimately translate into a day-to-day practice for pharmacists as well as for those businesses. And we'll also develop some understanding of innovative clinical services and how they might be implemented in the future. So a few of the other pieces, the health information technology. Monet and I worked very closely just this past week on a project to bring in how prescription medications and over-the-counter medications can be brought together on a combined electronic health record and the challenges that poses for a health information technology. And so we're not necessarily working specifically with pharmacy and pharmacy entities. We're also able to work with other organizations that include health information technology vendors. We have the opportunity to do some grant writing as well as we begin to build and maintain a research portfolio for the foundation. So a lot of that ranges from to finding a grant and possibly assessing if it's a possibility for us as an association to pursue, and then ultimately writing that grant to see if we can be awarded that. And once again, it comes back to the project management where we've written the grant and been awarded the grant, and then we go to the project management piece of it where we then move forward with implementing the grant. So those skills have ultimately developed or been given to a number of previous fellows, and I think Renee and I are very prideful of the rich history of fellows that have come through the program, and we're proud to now present to you where they're employed and the types of roles that they've taken on. A lot of them do tend to stay within the pharmacy realm, but there has been expansion beyond that into groups like STC, which is a Science and Technology Corporation, as well as Humana. So we're working with payers and other organizations. So not just specifically with those chain drugstores such as Walmart, Walgreens, and CVS, but into those different entities that interact with pharmacy and pharmacists on a daily basis. So all of the details that you need to know about the application process and deadline are briefly summarized here. The applications will be due December 15th, and they'll include four components there. So a current resume or CV, a scanned copy of your transcript, a cover letter explaining your career goals and interests, and one letter of recommendation from a dean, faculty member, or recent pharmacy employer. And we will conduct an initial round of interviews via phone, and then those finalists or a short list of finalists will be invited to the NACDS office in order to conduct a half-day on-site interview. So we'll be scheduling those interviews between late January and through February, and aiming to notify those successful applicants or applicants by the end of February of 2017. And I'll mention the reason I say applicant or applicants is because at this point we're unsure if we will be hiring two or selecting two or one fellow for the upcoming year. So in any sense, there is still an opportunity with NACDS and the Foundation Fellowship. So we highly encourage you to apply. And I think I'll hand it over to Mel now. Apologize for the delay there. So Mel, take it away.
Thank you, Lauren. And thank you everyone else for sharing about your unique fellowship and residency opportunities. I think we've heard a lot about all the unique different offerings that we have, and I'd like to share a little bit about the Pharmacy Quality Alliance. So if you've never heard of us before, I've provided our mission statement here. What we're most focused on is improving the quality of medication management and use across healthcare, the whole healthcare system. And the way that we do that is by working on development of quality measures. And what I mean by that is creating ways to measure whether interactions within the healthcare system were quality interactions. So that can be pretty complex. But a little bit about the Pharmacy Quality Alliance. We are a multi-stakeholder, member-based nonprofit organization. By multi-stakeholder, I mean that our members really run the gamut when it comes to pharmacy and even beyond pharmacy. We have academia involved, government organizations, quality organizations, chain pharmacies, independent pharmacies, associations like NCPA. So we convene a multi-stakeholder population to help us develop these measures to decide whether what we're doing in healthcare is quality. And it's really important to have everyone's word in that because it really helps to shape healthcare. So we try to make it a transparent and consensus-based process. So just a little bit about the Executive Fellowship. I have here, well, shortly I will have here a couple of our fellows who have graduated. We're currently in our 4th year of fellowship. Our fellowship is a 1-year fellowship. It's an association management experience, similar to what everyone else has talked about, and we do get involved in a lot of similar types of activities. So at Pharmacy Quality Alliance, you might find yourself working on writing grants or writing proposals to gain funding for new research projects. You might find yourself working on developing a measure, which could be anything from conducting an environmental scan or a literature search to specifying or managing the teams that help develop the measures. So you can really get involved in a lot. Other than association management experience and research experience, our fellows gain exposure to the broader healthcare quality landscape. So broad experience, I have here 3 of our last fellows. Our first fellow, Lauren Dixon, I just wanted to share where they landed. Because we do have a multi-stakeholder membership, we have the opportunity as fellows to shadow. So I have the opportunity to shadow in managed care or shadow a health plan or shadow in academia or go spend some time with a government organization. And so where we're starting to see our fellows land kind of is indicative of where they spent their time. So Lauren Dixon was our first fellow. Her first post right out of the fellowship was with Humana as a pharmacy quality and STARS maximization program manager. Maria Scarlatos kind of followed a similar path. She ended up with CVS Health as an advisor of the Medicare STAR ratings program there. And Hannah Fish actually stayed with us at PQA. She is the Associate Director of Education and Communication. So I'll just share a little bit about the application process before we move forward to our Q&A session. This is a link to our application process. You can find it just on our website under academics. Our selection process is detailed here. The really exciting news I have to share with you is that while the deadline on the screen may say December 16th, we have decided to extend that to December 30th, just keeping in mind the holidays and everything. So we're very excited for anyone who wants to apply. Requirements are a 1-page cover letter, your CV or resume, transcripts. A writing sample is recommended but not required, and 2 letters of recommendation. So please let me know if you have any questions. I welcome the opportunity to talk to any of you personally. I think we'll pass out our contact information after this, and there it is. We look forward to talking to you all.
Thank you so much, Mel. Thank you, everyone, for your great presentation and for sharing a little bit about your different programs. I'm sure you heard a little bit of consistency with the programs. There are some similarities between all of the associations and different groups out there and what you can expect in an experience, and then there are going to be some differences. We talked a lot about the application process, and I just want to share with you, we have the contact information here as we move into the discussion. Following this call, probably tomorrow sometime, we'll get an email out to you that has all of this information and links to the different programs, so you guys can get that as well as the presentation and the recording when it's available. Just a reminder, if you have questions, feel free to use the chat function and ask them, and we'll just kind of ask those as we move along to this discussion portion. So I'm just going to go ahead and get started with that. These are a little bit different. The association residencies and fellowships are different than your traditional residency out there. And I'm going to go a little bit off what we talked about here. Monet, you've actually done a community pharmacy residency program, and now you're doing the fellowship. So can you talk a little bit about that experience?
Yes, of course. So I, in June, just wrapped up a community pharmacy residency with Purdue University. It was in conjunction with a regional pharmacy just outside of the Chicago area, and it was actually the perfect transition for me to the National Association of Chain Drugstores. So what really piqued my interest into association management, or at least one of the many things, was that when I was on community residency, I remember a lot of the times the competencies that I was learning, they were considered innovative, or the projects I worked on were considered front of the line. However, I thought that they were feasible projects that could be implemented on a larger scale, which led me to seek out the National Association of Chain Drugstores. So the pilot programs that I worked on there are also pilot programs that I'm working on now, except they're at the national level. So with the hope that those programs are no longer innovative and they become standard models of care. So to all of the students who are listening to the webinar, if you haven't decided if you want to go into patient care first or non-direct patient care, just know that the options are out there, and you don't have to make the final decision for your career right now. I was at the same point as you just 2 years ago, and I ended up doing both. So if you have any questions about that transition, feel free to reach out to me. But yeah.
Excellent. Thank you so much, Monet. And this question is for the group in general. Why do you think student pharmacists should consider doing a residency or a fellowship? I'm going to send that over to you, Drew.
Yeah. So I think this is something that really comes down to personal preference. You know, Monet talked a little bit about a community pharmacy residency, and I know I'm sure some of you on the webinar are interested in clinical residency. And so I feel like a question that I get a lot of times is, what is it like not having that patient care, that patient interaction component? So a question I get a lot of times is, what is it like not having that patient interaction component? And I think it really just comes down to whether or not you want to practice clinically or if you're looking to advance the profession as a whole. And so for me, while I really enjoyed those AmCare rotations and some of those clinical rotations, I worried about, what if I was in that setting a few years later and I decided, that I really wanted to be working to advance the profession at a national level. So that was something that I really prioritized. So as you guys are kind of navigating your rotations, that's something to keep in the back of your mind and really be thinking about long-term, what are your career goals, not just short-term.
Thank you so much, Drew. That's a great answer. And that kind of plays into a question we have from Moody. Is that okay? So Moody had asked the question, as you're thinking about opportunities for your fourth year in APPE or APPE rotations, what are you looking for? And I know a couple of our residents in here have actually done APPE rotations in the association management field. So you guys want to talk a little bit about how that led you to consider residency?
Sure. Funny thing is, myself, funny thing is that I guess there's three of us in the room that actually all did fourth-year rotations at APHA. Drew, Lauren, and myself all rotated through there. And I think if you are looking for what the day-to-day life of an executive resident or fellow is like, that gives you a great look at what that might look like. And like Drew already mentioned earlier, no 2 days are alike. At any given time, you may be juggling up to a dozen different projects. And so as a third-year student, at about this time, you should have started to think about what rotations you are going to rank at the top of your list when you submit your list to your experiential directors. So I would highly encourage you to look into all four of our associations and have a rotation program. So definitely look at that as an option. And I'll turn things over to Drew or Lauren to add for comment.
Dr. Kirk?
Dr. Kirk, you want to take this one?
So I think Alex has done an excellent job establishing a solid basis as to how to decide and to look at these types of programs, particularly in your fourth year, as kind of an intro to them. And I would encourage those students that are looking at their fourth year to assess your current skill set and where you feel your strongest skills could be most effectively utilized. So if that is in the clinical setting and you have strong passion to be in the clinical setting and a skill set to go with it, then certainly pursue those options there. And to counter that, if you believe that you have skill sets within project management and the like, then certainly see how those skills would apply to these types of experiences in your fourth year. And while looking at the skills that you particularly have strengths in, you can look where you very well may have some lesser developed skills. And in that, begin to look at the programs and see where you may be able to develop those skills. So if project management and grant writing or working with individuals outside of the pharmacy professions aren't necessarily your strengths, then certainly consider these types of rotations as not only a means to build those strengths, but a means to understand if you should pursue an opportunity to build those strengths in the future.
Thank you so much, Dr. Kirk. We actually have another question from the chat box. Adamola is a second-year student pharmacist. They would like to know more information about possible internships and what opportunities might be available for a P2 or a P3 as they get prepared for an opportunity like a residency or a fellowship. And I'm actually going to take that one. So both APHA and NCPA have summer internships that you can apply for, and P2 going into their P3 year or P1 going into their second year are great candidates to look towards those. And I believe ours is 10 weeks long, Julie, yours similar, 10 weeks, 12 weeks, something like that. So all the information about those programs can be found online. Also, some state associations have internship programs, so you might look there. Your state association probably also has API rotations for you to consider. But that brings up a great point as far as staying involved throughout pharmacy school, and that's a key component, when you're looking at opportunities after graduation and looking at where you're a good fit. I know several of you guys have held leadership roles in your different associations or as a student. So, Lauren, maybe you want to talk about how your student leadership roles have led you to consider this, or what experience you gained from those?
Sure. So during my third year as a student pharmacist, I served with the APHA ASP, or rather Academy of Student Pharmacists, National Speaker of the House. And in this role, I was responsible for working with students to ensure that their legislative and policy efforts were on track, and I served as the steward of their voice when it came to a advocacy role. So in that role, I gained some experience with public speaking, with also presentation skills, and certainly some leadership skills in that role. And it ultimately allowed me to see that I had a passion for inspiring others, for working with others, for representing others while they pursued their passions possibly on the front lines of pharmacy. And so it led me to consider these type of opportunities, these non-traditional options, simply because it allowed me to pursue those passions that I had outside of the front lines, while supporting my colleagues that were arguably better at the clinical role on the front lines, and had that desire to be in front of the patients and interact with them. And so as to not take away from their opportunities, I looked more towards the non-traditional options, and built, as I mentioned before, some skills that could be effectively utilized in these non-traditional roles.
And I'd also just like to tackle into that, as you're navigating your way through pharmacy school, just remember, while you're a pharmacist, you're also a healthcare professional. So something that I think is valuable to all of these association managements or any non-direct patient care role that you pursue is an understanding of the entire healthcare system as a whole, especially because they're in a very trusted environment in healthcare. So I would even encourage pursuing internship and summer programs outside of the realm of pharmacy that still contribute to healthcare, whether that's in government affairs or it's something at like the state Medicaid department in your particular state, or even within your school in a different school. Like I know that there were opportunities in the School of Public Health at the University of Maryland that took an interdisciplinary branch. I think those skills translate a lot better into the association management world than if you went into a patient care role.
Thank you, Monet, and thank you, Lauren. Those were great. Now I'm going to ask Mel a couple of questions. Association management, residencies, and fellowships really provide numerous networking opportunities, and PQA has such a diverse membership. You guys have representatives from all across the board. So what type of relationships have you been able to develop so far? Have you found a mentor? You want to talk a little bit about that?
Sure. Thank you so much for asking that. For me, it's a really good question for you to ask because I come here from Arizona, which is very far removed from the Washington, D.C. metro sort of area. And, you know, in Arizona, we're very far removed from everything that's going on and up and coming in government and healthcare. We don't have those automatic links in. We don't get those lunch invites almost weekly that I've been getting on these in this fellowship experience. For example, tomorrow I'm going to spend a half day at a Pfizer-hosted event in healthcare. And it's just really incredible the amount of networking opportunities that have been provided by coming here and being in one of these fellowships. And I think every one of us fellows and residents can speak to that as well. And what's really unique about PQA is that with our multi-stakeholder membership, we have the opportunity to really interact with all aspects of healthcare, like I said before, from academia to health plans to hospitals to community pharmacy, even to the health information technology vendors. So it's pretty incredible the opportunities that I've been offered and just the increase in my network in less than 6 months. It's more than twofold. It's like 50-fold. It's been really great.
That's awesome. That's really cool. So we've heard a lot from the different groups about association management and the different opportunities you get to learn about through just, in essence, being in the office and getting to interact with all those people. But one of the cool things about being in an association is you get to be on the cutting edge and hear about sort of the newest things that are coming down the line to healthcare and being involved in or having a role in kind of the implementation of that. So Alexander, what would you say is the project that you're most excited about that you've been working on here at NCPA?
Sure thing. I think there's been a lot of projects that I've been working on, and I'm currently juggling at least half a dozen that I know about, and then there's probably another couple that I will be told what I will be needing to do tomorrow. But it's always an amazing experience here because of that variety that you get in your day-to-day. And the project that has kept me fairly busy and that I'm really excited about is working on a toolkit to help pharmacists work with prescribers. And as Mel can probably tell you, we are seeing a shift in our healthcare system from a quantity-based merit incentive to a quality-based merit incentive, which means that prescribers won't be able to just see more and more patients and get paid for that service. We have organizations now looking at the quality of care that's being provided. And while pharmacists aren't directly being affected by that now, it's surely in the pipeline where we'll be soon to be affected by it. So one of the things that I get to work on here is to come up with some solutions for our members as it pertains to how they can better work with prescribers and develop those relationships and find new opportunities to provide new avenues of care to patients. And so pharmacists traditionally have worked pretty much kind of in their own little box, but we're starting to get to a point where it's all about team-based care, and pharmacy is right in the heart of it.
Drew, you want to add to that?
Yeah, I would say I'm actually working on a similar project with APHA, and so this has definitely been something that has been in the pipeline for a few months now. And it's really probably the first project that, when I was introduced to it at APHA, made me feel like I was really making kind of a difference at that national level, and that's what I wanted. So I've been working on a policy background paper for the last few months on pharmacist involvement in collaborative practice agreements, statewide protocols, and standing orders. And I know that's a bunch of terminology, but just to expand on that, it's basically pharmacists working with prescribers or with state boards of pharmacy or state boards of medicine to actually be able to initiate medications. And so as we, are in this time in the healthcare system where there's a nationwide shortage of primary care providers, we're really seeing a lot of opportunity for pharmacists to kind of take the initiative to step in and fill that gap. So this is something that will be used at our within our policy committee and at our annual meeting in the spring, and the APHA House of Delegates will actually vote on policy based off the background paper that I was able to write. So that's been really cool to be involved with kind of the future of practice for pharmacists there.
So alternatively, on the practice side, one project that I thought was impressive when I joined the NACDL Foundation actually happened on the Pacific Northwest coast. And if you're from that area, you may be familiar with this project. It's called 20 Minor Ailments. So Washington State is one of the states with the more expansive scope of practice acts in their administrative code. So they have a little bit more leniency with what they can do as pharmacists. So they use that to their advantage. So the project that we're working with them, with the academicians and the stakeholders, which are the pharmacies in the area, and it extends across the state, and actually we're extending it into Canada. And then we're also working with a physician's team. So we developed, it's not 20, but there are actually 21 minor ailments where we developed a collaborative practice agreement for each ailment, where a patient can come into any pharmacy at any time and receive diagnostic testing and treatment right there on the spot. So an example, contraception is fairly popular, but if a woman had a UTI or a minor burn, or they wanted to receive insulin and they wanted to scale it to wherever they are based on their results, animal bites, there are a couple of other infectious diseases that you can get right there on the spot in pharmacy. So we're taking a look at that, and we're measuring it both clinically and economically. So once we wrap up this leg of the project, we're going to go ahead and move on to the next phase, where we're comparing it to the cost of emergency room, urgent care, and primary care physicians visits. And we're going to compare those outcomes and kind of present that as one conglomerate of data. And to me, this was impressive because that is what the forefront of pharmacy is, and that's the type of model that we're trying to create a standard for. So that's something I'm working on now, and it's going to extend beyond the time of my fellowship, but I'm really excited to see where it goes next.
That's great, Monet, and thank you so much for sharing. I'm going to share just for a second here. I am actually a past NCPA executive resident from the early days, right before the Affordable Care Act was rolled out. So my residency project was getting independent pharmacies ready for the Affordable Care Act. And that was very interesting, learning all about the Affordable Care Act and also the shop marketplace, where small businesses would buy insurance, because most of our members have less than 50 full-time employees and could possibly be using the shop marketplace to look for health coverage. So I put together a toolkit. I went to speak at a couple of pharmacy associations, state associations, went to speak to membership, schools of pharmacy, and then presented it at our annual convention on the topic, getting pharmacies ready for the insurance exchanges. Some of the past residency projects have just varied quite a bit. Last year we had a transitions of care toolkit, because that's very important for pharmacies. Right now, with the Innovation Center that NCPA just launched, it's all focused on helping independent pharmacies stay competitive and stay profitable in a changing healthcare environment. So we're looking at new payment models and ways that we can really demonstrate positive outcomes for patients. And it's a really exciting process to be a part of, and we're happy that our resident falls in that department. And I will finish my commercial and move on to what you guys really want to know and ask the group more questions. So Mel was a little hesitant to answer the question what project she was most excited about, because she has so many projects going on right now. So could you take us through what a day in your life at CQA has been like?
Sure. I almost feel like that's an even more difficult question to answer but I'll try my best. So we focus a lot on improving quality. I talked, of course, about improving quality in medication use, but quality is always at the forefront. So as a fellow at the Pharmacy Quality Alliance, you are given the opportunity to lead your own group of individuals, and that opportunity comes in the form of the Academic Affairs Committee. This is a committee made up of faculty members from universities and schools and colleges of pharmacy across the United States, and also ambassadors, which are quality champions that come from our other membership organizations. So perhaps someone from Humana happens to live near their alma mater and wants to represent quality in education at schools and colleges of pharmacy. So they might be involved in the Academic Affairs Committee. So the fellow is the sole person responsible for managing the Academic Affairs Committee, and that is a group of people that meet monthly, every single month. You'll decide in the summertime what your initiatives are going to be. I'll share with you some of those. But I just want to stress how exciting it is that I came into this position and they said, here you go. Take this, run with it, have a lot of fun, and it's really mine to manage and do what I'm going to do and do a lot of exciting things with. So some of the Bree shared that there were a lot of projects. I can't pick one, so I'll share just a couple that we're working on. One of the initiatives that the Academic Affairs Committee of PQA does is they put out a call for abstracts for the annual PQA poster session. So we manage everything from gathering our abstract reviewers to our poster reviewers. We develop the rubric every year and make sure that we are assessing the posters as they need to be, and then we make sure that the abstracts that were submitted are published in a peer-reviewed article. So that's a big ask just in itself. But some of the other really exciting things that are quality-based in education, which faculty will be interested in, is right now we're surveying all schools and colleges of pharmacy to find out how each of them teach healthcare quality and what are the best ways that it's being taught, so that we can create a toolkit for all schools and colleges of pharmacy to make sure that the healthcare quality message is being spread across to all pharmacy students, because I think you will have noticed that each one of us has kind of touched on the shift from volume to value within the healthcare system. So I'll leave it at that. I could talk about a lot more projects, but I'll leave it at that for now.
Yeah. Thank you so much, Mel. I just want to remind everyone to please ask your questions through the chat box there. And I do want to let you know that all of our executive residents and fellows on today's call will be available in person to talk with you at mid-year in Las Vegas. You can find them the Tuesday session of the Residency Showcase on December 6th in the afternoon in booth 6407. But we've talked quite a bit about, what you do at the association during your residency and during your fellowship. And it is a lot of association management, but it does key you up for quite a few different avenues of pharmacy. And Mel and Monet and Lauren all shared kind of some of the different opportunities that are available, or some of the career positions that their alum are in. At NCPA, we also have a strong history of good positions. Some of our alum have held state representative positions. They have one is the current exec of a state association, head of an innovation center in South Carolina, as well as community pharmacy owners. Our 2012 resident just opened her pharmacy a few months ago, and the APHA Foundation executive residency also has a very similar strong history. So, Drew, can you kind of share a little bit about what your colleagues have done?
Yeah, absolutely. So the cool thing about the residency is that you're really able to kind of use your time and gear it toward where you want to land after you finish the program. Our most recent resident works for a school of pharmacy now on a recruitment type basis. We have several of our residents who have stuck around and currently work for APHA. That's probably the most common pathway. whether working for APHA or another pharmacy organization or association. We also have another resident who actually works for the National Alliance of State Pharmacy Associations. So her position is really interesting in that she's kind of working with all the different state pharmacy associations. So she's traveling a lot, engaging what's going on at the state basis, where APHA is really concerned with more of what pharmacy looks like from a national perspective. So you can really use the time throughout your residency. I know personally for me, I'm looking at not only national pharmacy associations, but also state boards of pharmacy and state pharmacy associations. So I'm really able to use that time to make sure I get experiences in development and budgeting, project management, planning meetings, things like that. So it's been great.
Alexander, you want to add to that? Oh, sorry, I thought you were raising your hand. No, okay. Sorry about that, guys. I do want to ask one more follow-up question because we're getting a little short on time here. But I want to ask the question to each of you guys. You know, what are your plans after post-residency or post-fellowship? Who wants to take that first?
Okay, just said that.
Drew just shared what he's looking at. Monet, you want to share? I don't think you wouldn't call on this. But Lauren and I talk about this on a daily basis, so it just kind of set in that we've been here for 6 months, and they say it goes by fast. They said the same thing about pharmacy school, and I was sitting in the classroom like, this sure isn't going by fast, but it really does go by fast. So to answer your question, what I'm looking at next spans across a lot of different topics, not one specific organization, but I have identified my passion for community pharmacy through policy and association management. So I've been identifying the skills that I have here at NACDS and how they're transferable across different organizations. Aside from that, I'm also fairly skilled in grant writing and project management because of that. So I now am confident in stepping outside the role of pharmacy. So I'm not even just looking within pharmacy organizations. So hopefully there's a follow-up webinar in 6 months, and we can all tell you where our positions are, and then that'll shed some more light on the opportunities that are presented to you through these programs. Mel?
All right, my turn. So this is always a tough question to ask. I have to say the reason why I chose to apply to PQA was that I was going to gain exposure to a lot of different sectors of healthcare, and I would learn what quality means to each sector. Before, I took a non-traditional path to pharmacy school. So before I started pharmacy school, I was in corporate restaurant management, and I did a lot in quality assurance. And so quality has always been near and dear to my heart. So all throughout pharmacy school, I got involved in quality improvement research projects. And the next best step seemed to be to go to PQA and to learn more about healthcare in general and what healthcare quality means to all different sectors within healthcare. So I came into this not having any idea what I was going to do when I got out of it. All I knew was that I was going to learn what all the other industries did. And come to find out, I think I'm going to go back home to Arizona. So I have a few options open to me that I'm exploring. But just like everyone else has said, I definitely want a position that's going to allow me the ability to get involved in projects and research and innovative program development. And so through this fellowship, I'm identifying the things that I really love to do, and I'm looking for that in my next position. So I can't name a specific place yet, but I can tell you what I enjoy doing through this experience.
Excellent. Lauren, do you want to add to that?
Sure. I think as Monet just mentioned that we discuss it on a daily basis, I think she can probably testify to both of our preferences or our pursuits changing on the same frequency on that daily basis. Like Mel, though, I have an idea of what skills I want to pursue and what opportunities are out there, whether they be in innovative pharmacy practice, effective advocacy, or some type of individualized education. I'm not sure where and what role that is, but I have always taken the philosophy not to limit myself geographically. So I can see myself in an association management role, engaging different stakeholders and bringing them together for a common goal, or pursuing something in a private industry or private business where it can ultimately support the profession, whether that be in a pharmacy-specific way or a broader public health way. But at this point, I will say that I have I don't know what I want to do, and I have had many mentors mention to me that that is perfectly fine, and that the point from A to Z is not always through B, C, D, E, F, G, and all the way to Z. It can be a very convoluted process and one that takes you on a journey. And so I encourage those that are listening tonight not to feel anxious if you don't know exactly what you want to do next year or in those years beyond, simply because it does leave you the opportunity to adapt and to move and to adjust where exactly you want to follow and where you want to pursue based on that basis. I think we as student pharmacists, or we as pharmacists, future pharmacists, however we want to qualify ourselves here, as generally type A personalities, we like to have everything laid out and structured. And so that is not how I've come to understand career paths work. So with that, I think I'll turn it back over to you, Bree, hopefully offering some degree of wisdom within the 6 months of the perspective that I've gained.
Alexander, same question?
Well, I think the sky's the limit. Being here has really allowed me to network and meet a lot of who's who in pharmacy, and I think that goes a long way, especially if they can see the fruits of our labor here in terms of the type of projects that we work on and their effect on healthcare as a whole, not just pharmacy. So right now I'm definitely open, just like everyone else, to a lot of different avenues, but part of me does itch to go back into practice, and eventually be an owner someday, so that's definitely still on the table, but I definitely love working in the association space. So at this point, who knows? We'll just have to see where the road takes me.
Thank you, Alexander. Well, thank you all so much for joining us tonight, and thank you to all of our panelists for sharing a little bit about their programs. I think this has been a great webinar, and I hope you were able to get something out of it. And I wish this would have been available whenever I was applying to be able to talk about the different programs. Just a reminder that we do have 2 Future Pharmacist webinars next week, Tuesday, November 15th and Thursday, November 17th. Both will be featuring community pharmacy resident panelists from all across the country. You don't want to miss out on either one of those. We'll make sure that information is included in the email following this call, probably tomorrow sometime. So if you have any questions, please don't hesitate to reach out to us and to Alexander, and we will get your questions answered. And thank you so much for joining us this evening. Have a good night.